I'm Dr. Brooke Conway-Kleven, physical therapist at Care for the Kids Foundation. Dr. Ikeda had reached out a year and a half, 2 years ago almost, I guess now, because they had a physical therapist a long time ago, part-time, and they started realizing they just really wanted to build a program. And so knowing my background and having my own private practice, they thought that I would be a good fit for helping develop this program. And it started out something that we thought was going to just be kind of part-time growing, and now a year later we are a department of 3 physical therapists, a speech therapist, and still growing. We started realizing there was so much of a need for what we do. So like I said, it started out being a small, I would help in the bleeding clinics, or I would help in the long-term follow-up clinic. And so it started out as an idea of like, hey, we need a physical therapist to help part-time in these programs. To then we started seeing that there were so many more things that if we could intervene at an earlier stage of diagnosis for our kids with cancer, or if we can start intervening more frequently with our kids with sickle cell, we can decrease their rates of a sickle cell crisis. So there were so many things that we just realized, get a physical therapy program, and then speech therapy, which is where the whole concept of physical medicine came from, because it encompasses physical therapy, speech therapy, occupational therapy, and eventually we also want nutrition as well. So we're starting to realize that this is just a big team of preventative healthcare measures that we are helping these kids not only get better with where they are right now, but prevent a lot of long-term illnesses from developing. It was funny because when I first came on, they had absolutely nothing put together for physical therapy, for anything. So I used to joke around that I was the squatter, because I just found a random office that was empty. So I was like, this is my office. I saw an exam room that wasn't used often, so I was like, this will be the exam room for physical therapy. So I kept just kind of working with what we had, and so it's amazing to see what we've built even in this short amount of time. I know at times it feels like it's been a slow process, but we've gone from literally nothing to having a full, very high caliber gym and full department with a full team in less than a year. So we're growing pretty quickly, and where I foresee us being in the next 5 years, I'm so excited for, because I don't even think it's going to even look even like this. Annette and Dr. Ikeda were amazing, because I've never worked in a place where I have so many big ideas and things I want to do, and everywhere else I've ever worked or been, they always tell me, well, that's nice, but you need to really decide what you want, because that's not possible. And this is the first time that I've told somebody, hey, this is what I want and this is why, and they say, okay, we'll make it happen. And it's incredible, because I have this amazing, powerful team supporting me and behind me with everything I've been doing. And not only are they supportive, but they also give me great ideas, and they've helped me grow to far beyond what I even imagined. This, like I said, this, where we are right now is so far beyond what I even imagined. And so in 5 years from now, I can only dream what this will be for all of our kids. Right now, just because our department is so relatively new, a lot of the kids we are seeing or getting referrals for are a lot of oncology kids. So once, because of a lot of the different chemotherapy or steroids or the cancer process itself, there are a lot of secondary comorbidities that we see. So a lot of the kids have peripheral neuropathy. A lot of the kids may have cardio or respiratory issues because of the treatment. Obviously generalized weakness and loss of muscle and hypotonia and loss of bone density. and actually obesity rates increase as well. So right now what we're seeing are kids coming to us with all of these things already. And what our goal is that as this department grows, rather than getting a referral to us once these things have already happened and these kids are experiencing these symptoms right as they are right now, we foresee getting a referral at the time of diagnosis, because we know these things are going to happen from research, from experience, from clinical observation. These complications are pretty much inevitable. So if we can intervene prior to that happening, we can decrease the severity of them. Questionable whether we can actually eliminate it altogether, but we can definitely decrease the severity, which therefore increases their prognosis, and then their long-term outcomes are significantly improved as well. A lot of the more hematology population are our kids with a lot of joint illness, or our kids with sickle cell who are experiencing a very high level of pain. So pain is something we focus on, whether in the oncology or hematology realm. And pain neuroscience is a huge component of especially physical therapy, that not only do we change how they're moving better, so it's decreasing their pain, but we're also getting them thinking about and feeling their pain differently. Pain does not have to be a natural process of any of these things. So if we can change how they perceive their pain and how they respond to their pain, then that actually helps their healing process. A lot of new research is looking at, especially in regard to bone density and regard to neuropathy, are the two areas of research. We see this a lot in pediatric oncology, but if you can intervene at time of diagnosis or throughout the duration of treatment, rather than waiting till after treatment is over, it very much decreases the severity of the complications, and long-term kids are actually having much better prognosis as adults if you intervene at an earlier stage. Parents are terrified, families are terrified of these horrible diagnoses that their kids are getting. And so a lot of times it's this bad cycle of a lot of the complications due to the pathology itself. And then you have a lot of fear, hesitation, change in behaviors, change in routines. So then that's decreasing activity. And then because of that, then the child is feeling horrible. And so then that causes more fear and anxiety in the parents, because they're seeing such a change in their child. So then it ends up causing even more lack of mobility. So it's this very bad cyclic behavior per se, that it naturally happens from the pathology to the behavior to the change in function to then changing a lot of the outcomes. So if we can intervene from the beginning and say, hey, look, exercise and movement is not going to hurt your child. It's actually going to help. It's going to help them cope with the process. It's going to help them cope with the treatment. Their bodies actually metabolize the chemotherapy and the steroids better if they're moving more, and if they're hydrated, and if they're doing these things. So I think if we can educate families from the very beginning, it's changing their mindset of how this treatment process is even going to look. If you think about it, these kids and their families, their entire life is flipped upside down from this diagnosis. You have a lot of kids extremely active in extracurricular activities or sports, or younger kids, they're running around, jumping around crazy, and then all of a sudden this diagnosis happens and everybody's life changes 180 degrees. Cancer itself, pediatric cancer itself, is a very rare disease. We see it a lot here in this clinic because this is what we do. Them understand and cope with, hey, your normal routine can still stay. We just need to make maybe these little modifications, rather than saying, hey, your life is over for the next 2 years. I think what we bring differently, and especially myself, is we do know better, in the sense that we know that we can push these kids a lot more. Obviously, There's going to be times and periods through their treatment that we can't push them. So when I say we're pushing them a lot more than other people, I'm not saying that's a constant. It's very much dependent on each day, and plan of care very much can change from day to day, hour to hour with these kids. However, when they're doing well, when they can tolerate this, we know very well that they can handle a lot more than what most people put on them. And we also know, and this is one of the incredible things about Dr. Ikeda and all of our oncologists on staff, is they very much believe in this multidisciplinary approach, that it's not just them treating these children, it's all of us. A lot of my goals are in relation to research. A lot of clinicians don't love research. However, when I look at what we do here, I believe so wholeheartedly in what we do, but at the end of the day, I know there's a limit to what we can do. Meaning that we can only see so many kids in the day. We can only treat so many kids in a year. But research, if you can take what we're doing here and build from it and learn from it and grow from it, then we are not only helping those thousands of kids in a year here, but we can help millions of kids because we have such an incredible team here, that I want to build that research infrastructure that we can say, hey, this is what we're seeing, this is what we're doing, these are the interventions we're doing, and these are the outcomes that happen from them. And if we can show the rest of the world how successful we are in data, then we are not only helping the kids here in Vegas, but we are potentially helping kids all over the world. Right now, we are putting together a cohort study for all of our kids with cancer. This is going to be a long-term study specifically looking at outcomes of kids with physical activity. So our goal is to get an activity watch, some sort of fitness tracker for every single child that's in our program, and observe them over a period of 3 years. And then we are going to have yearly follow-ups and physicals for each of these kids, so we can observe and watch over time and see the children or young adults who are more active, if they have improved outcomes and less risk of relapse, less risk of additional illness. So this is a huge thing because we know exercise is important. We know physical activity is important. A recent study came out last week actually showing that walking speed is one of the most important indicators for mortality from cancer. So purely looking at how fast a child can walk is one of the biggest indicators of whether they're going to live from a cancer diagnosis or not. Like, that is huge. So if we can actually build a study where we're monitoring these kids, not only just while they're here in clinic with us, but every single day for 3 years, seeing how active they are, seeing how much they're moving, and then looking at what their outcomes look like, that is a bit of research that nobody has done yet.